Doctors have read it. What is your how the hell are you alive right now story? A guy came in about 10 minutes away from death. He had been run over by a car. By the time we prepped him, he had passed, but per the doctor's moral code, we tried to save him anyway. After hours of constant work, we gave up. We declared him dead and were packing up when he woke up. Like some horror movie type stuff, he just sat up straight and inhaled loudly. My assistant and I just looked at each other. It's been a couple of months, and he's still in ICU, but this memory will always give me goosebumps. I had a patient that said she cured her AIDS. Thinking, okay, that's not really possible. I just completed her completely routine eye exam after looking for hemorrhaging or anything in the retina. I finished the exam and sort of just out of curiosity asked how she cured her AIDS. I'll never, ever forget the response. Dilute 1 cup of bleach in an 8-ounce glass of water once a day. My jaw met the floor. I had a patient once who I use as an inspiration to others. In his late 40s, he was diagnosed with alcoholic cardiomyopathy. His heart was only pumping 15% of the blood out per stroke. A normal one should be pumping 60% or more. He also was diagnosed atrial fibrillation, diabetes, and hypertension in the same day. He weighed 140 kilograms, smoked heavily, ate nothing but food from the pie shop, and spent every night in the pub. The cardiologist told him he was basically about to die and was put on 5 different medications. He stopped drinking altogether, started exercising, quit smoking, and ate nothing but salad. He lost 45 kilograms, his diabetes reversed, and he stopped some medications. His heart went back to 55% stroke volume, and most of his heart failure meds were stopped. His blood pressure dropped to normal. He was the happiest he'd ever been, and not just to be alive. After a couple of false starts, he found himself a decent girlfriend. He still went to the pub for the social aspects but drank soda water. He was quite the inspiration to many people in the small country town where we were living at the time to improve their lives. I saw a patient, 23 years old female, who came to the outpatient department with fatigue and dizziness. She was pale as a sheet and painfully thin. Her blood was drawn for testing, and it looked translucent, like red wine or something. So, when her hemoglobin was tested, it turned out to be 1.1. For reference, normal range is 11 to 16, below 4 is very severe anemia. Hemoglobin less than 2 is not compatible with life, mortality should be at 100%. She had the symptoms she was having for 2 years, and she wasn't even in the ER. She could walk short distances, talk without getting out of breath. We thought there was some technical error in the test, so we sent 2 different samples to different labs while blood cross-matching was going on. The results came back as 1.0 and 1.1. She got her bottles of blood, was diagnosed with 2 different types of anemia together, and got treated. She went through what would have killed almost anyone and looked much less sick than most patients, with a hemoglobin of 6. I remember when I was an intern in the emergency department, when a 30-year-old guy came in with simple URTI symptoms, essentially coughs and the flu. However, the paramedics at triage found that his oxygen concentration in his blood was low, and there were some crepitations in his left lung. It was pretty standard, early-stage pneumonia. I didn't like the sound of his crepitations, however. It was way too loud and far in between, and I don't hear any normal breath sounds. The patient was very comfortable, otherwise. So, off he went to do some x-ray. I got my answer and the shock of my life when he came back. His left chest cavity was filled with bowels. The crepitations that I heard were bowel sounds. Simply put, the guy had no left lung. Judging from his comfort level and his own shock, we suspected it was congenital. We diagnosed him with a simple URTI and sent him home after routine observation. Bonus story, a couple of months after that, there was a middle-aged, probably 50-year-old lady, who fell and had a laceration wound over her forehead. We patched her up and sent her to the X-ray to see if there's any fracture. What we saw was that she had scores, maybe hundreds of tiny needles embedded inside her skin. My boss told me that it's susuk. Susuk is a traditional cosmetic surgery procedure that has been practiced by my people for hundreds of years. The myth was if a magic man buries gold needles inside your face, you can look young, charm people, even gain magical powers. It was 3 a.m. on a Saturday. I was working in the emergency room of a level 1 trauma center, and we had 3 people coming in after a gun battle. We only had 2 beds designated for severe trauma, so there was the typical discussion, which 2 people to try to stabilize and which person to delegate to the makeshift trauma bay. Do we focus on the most severely injured or the two most likely to survive? After what seemed to be a nearly comically drawn-out and shakingly quiet wait, the first two victims arrived, and the stillness flipped to chaos. The first person wheeled in just didn't seem to have a head. There was this bloody mass at the top of his neck, but it didn't look human. I remember being so confused that we were using one of the bays for this person, who just could not still be alive. I was looking over him, and I noticed his left thumb was calmly and repeatedly cracking the knuckles on his left hand. It would squeeze one finger and rhythmically work down the other four and start over. He didn't have any anatomy left that we could easily intubate, and yet he was cracking his knuckles. I still can't make sense of it. He didn't stay alive much longer, maybe a couple of hours, but that knuckle cracking seemed like such a human thing to do for someone that had no reason to still be alive. I was in my 4th year of medical school and on the first day as an intern in a trauma hospital. There was a bus crash right before, so all the staff was occupied when a woman came in screaming, "I am going to die! I got shot in the head!" When I look up, I see a really thin woman, deep eyes, white as snow skin, with a bullet hole in the center of her forehead. She told us she owed money to a drug dealer, and he put a gun against her head, shot and ran. I believe her because she has burn marks and gunpowder right there in her skin, and a hole. Now, remember that I am a student, and there was no available doctors in the moment. So I run to my professor, who was with another patient, and tell her story, and also that she is lucid, with normal life signs. I get ordered to do a CT scan. The CT scan shows that the bullet entered the forehead through the first layer of the frontal bone, but not the second, and headed down through her palate, passing through and stopped at a vertebra. There was no brain damage at all. So, we intern her, and a tracheostomy is put in place, along with emergency reconstructive surgery, along with a cervical collar. After she is stable 3 hours later in her room on the 3rd floor, we go down to see other patients. The emergency then gets a call from a hospital 20 kilometers away from ours saying they found one of our patients in their emergency. Then the nurses on the floor realized she was missing. She jumped from the 3rd floor, broke her ankle, and got in buses until the other hospital. You are probably asking yourself why she did that. She said, "I saw him in here, he came to finish the job." And before you ask, yes, some people lost their jobs. I work at a trauma center as an anesthesiologist, so I see a lot of crazy things, people surviving stabbings, gunshot wounds to the head, a freeway collapsing on someone during construction, but one case will forever stick in my mind. I got called down to the ER to help manage an airway. The call said there was a woman who had a difficult airway due to trauma, and there was a splintered piece of wood in the way. I walk down, ask what the story is. A little old lady lost control of her car, ran off the road into the side of a house. She ran into a wooden porch that was positioned almost exactly at the level of her nose. So, I approached the lady to see what we're working with for an airway, and she legit has a chunk of wood that has smashed her nose, which is sitting right between her eyes. The thing must have been 3 inches wide, God knows how long, and about 1 inch from top to bottom. About 4 inches of board is sticking out of her face. My immediate instinct is to say, "Holy." Fortunately I didn't, because it turned out the woman was conscious at that moment. I intubated her, she went off to the scanner, and then to the operating room. Last I heard, after a series of reconstructive surgeries she was doing pretty well. I occasionally think back to that moment, and just wonder how the hell that woman was alive. I had a middle-aged woman who hadn't seen a doctor in many years due to poverty. She came to the ER with a little shortness of breath and a slowly enlarging abdomen. The CT scan revealed a tumor larger than a basketball ball in her abdomen that took up 90% of her cross-sectional surface area. Her inferior vena cava was essentially collapsed, the aorta severely compressed, and her intestines crowded into a small bunch in 2 different areas. On top of that she had a large pulmonary saddle embolus. All this, and her only symptom was a little shortness of breath, no pain, and no lower extremity swelling, not even any constipation. She should be dead 3 times over from the tumor's metabolic burden, the mass affecting her abdomen, and the massive saddle embolism. 5 years ago on Christmas morning, I get a call from a colorectal surgeon. I had my Santa hat on and was watching the kids play, ready to enjoy the day. I didn't expect anything good, of course, I'm an anesthesiologist. Apparently, a patient who had been in the hospital for a bowel surgery a week ago had leak in that connection. Basically, poop was leaking out of her gut and causing a nasty infection everywhere it touched. I get to the ICU, and her blood pressure was 50 to 70, while on 3 drugs designed to increase it. In other words, she was about to die. Her blood acidity was also nearly incompatible with life at a pH of 7.1. I told the family as we left that there was a very realistic chance she wouldn't survive surgery, which was met as you'd expect. Anyhow, we start the surgery, and I was able to place IVs in a big vein and an artery. I put a breathing tube in, and we start the surgery. The surgery was relatively simple: reconnect the intestine and wash everything out. It took maybe 30 minutes. The problem was that every few minutes, her blood pressure would go unreadable. I ended up using 5 times the recommended dosage of blood pressure medications and eventually had to do compressions on her chest. Meanwhile, I recall thinking that I would absolutely not let this woman die on Christmas. After going through 5 rounds of CPR, I finally get her stable. I bring her back to the ICU with a breathing tube, all sorts of IVs, on all sorts of medications. She gets the tube out in a month and leaves the hospital in 3 months. Somehow, she didn't lose any mental function. Years later, the surgeon gets sued for not diagnosing the leak earlier. I would have been absolutely furious if I was named as well, but fortunately I wasn't.